Welcome back to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. Emilio Goldenhersch, my guest today, is the CEO and co-founder at MindCo Health. This company has always fascinated me, and when you meet Emilio, you immediately know that he's a real one, and you start rooting for him. Emilio is from Argentina, where he studied psychology. When he and his co-founders first launched their company, originally called MindCo Health, it was focused on using virtual reality to help people stop smoking. Fast forward to today, the heart of the business for Emilio and his team has always been helping people with mental challenges in a way that's incredibly accessible and scalable. Their latest move, now under the name MindCo, hits the same notes, but in a new way. As you'll hear in my interview, Emilio is doing what he calls psychologist arbitrage. He's connecting highly trained mental health professionals from Latin America to American patients. They're also using AI for triage to make it even more affordable and accessible. Personally, this has always seemed like one of the great unlocks for telemedicine, opening up a high-quality global workforce for particularly entry-level care and then connecting in with a local provider when the care needs to get escalated. But we really haven't seen much of this come to reality. And in fact, the opposite is true, as we've seen telemedicine efforts dwindling and faltering of late. Perhaps Emilio's fresh approach to workforce arbitrage could breathe some life into the telemedicine market. If that's a tall order, it will at least make early intervention for mental health care more accessible and affordable. Let's get into the interview. Give me a sense of where MindCo Health is today and a little bit of that evolution.
Yeah, for sure. 7 years ago, we started with smoking cessation with virtual reality with your phone. Now, that was a long time ago. During COVID, we were able to transition to mental health.
Okay.
We replicated the same model, virtual reality mobile, for mental health, stress management, resilience, coping skills, and stuff like that. And then we recently incorporated also a network of clinical psychologists licensed outside of the US.
Okay.
You know, there is a big shortage of mental health practitioners.
Huge.
Now, I'm a clinical psychologist certified in Argentina.
Okay.
I studied for 8 years, just to be myself called a psychologist. Now, here in the US, I have not gone through like a validation, so I'm a coach. So like me, we incorporated a network of 500 clinical psychologists.
500?
Yeah, we recently incorporated this. This is kind of a pivot because we are trying to move forward to an arbitrage where we are bringing on the ability to have human-to-human connection and really provide coaching with top-of-the-class and best-in-class psychologists.
Yeah.
So acting as coaches, we don't prescribe, we don't, have like medications. We're not reimbursed through this model yet.
Okay.
Right. So the virtual reality, we still have it. We work for behavioral health interventions, evidence-based. We still work with that as kind of the coaching prescribing the content, right, from our app. But the initial and very much focus right now is the human-to-human component.
Okay, let's talk about that clinical talent arbitrage piece a bit, because in my experience, that was sort of part of the promise of telemedicine a decade ago. People talked about the cost issue and the access issue, and we thought about how there were these hundreds of thousands of talented clinicians around the world, like if we could just connect them. So talk to me about sort of some of the challenges and opportunities of doing that arbitrage work in real life.
For sure. So what you just said is very true. Right now we have hundreds of thousands of people not getting treatment, right? You have patients that are, for example, let's just talk about either cancer patients where they have 1 out of 3 suffer from mental health conditions and just 1 out of 4 really get treated for mental health. Yeah. You have the crisis with either low class kind of societies right now where we have homeless, we have migrants, we have different underserved and underrepresented communities, rural communities where nobody gets treatment. They don't have even one psychologist in their town. So telemedicine comes in a good spot there because we are able to bring immediate high quality care. This is not a clinical worker. This is not a counselor. This is not a health coach. This is a 15 years, 20 years of experience clinical psychologist ready to give a 30-minute session And what we are bringing on is this, again, highest quality at the lower price.
Okay.
We are we're trying to keep it accessible so it's affordable, and we're targeting the value-based models.
Okay.
Because...
And the clinician is abroad.
Yeah, it's
that
a clinician.
Helps with the sort of cost arbitrage.
Exactly. And then when we identify that there is a severe case, we are able to refer either to our own practitioners, US-based, or to the systems practitioners. Make it a health system, make it a practice, a private practice, or even a health plan practice. So whoever we can refer, or we can take it ourselves.
Okay. Help us just place what you're doing within the context of today's telemental health services. I hear a lot of ads on like NPR for BetterHelp and other services that are cropping up. Obviously, they're not doing this clinical arbitrage work. How else do you kind of compare yourself to the marketplace?
For sure. So one thing that usually traditional protocols for mental health referrals or for either any kind of behavioral treatment are isolated and are broken and are costly.
Okay.
So we are not isolated because we are integrating it with AI triage at the beginning to really differentiate if a person needs behavioral health, evidence-based, self-paced interventions. That's our audios, videos, VR, whatever.
Okay.
We also have a 24/7 AI generative companion that basically provides empathetic listening and compassionate listening.
I'm feeling depressed, I'm feeling anxious.
24/7. You can feel, but this is a conversational. We are not doing diagnose, we're not doing early identification. This is somebody you can talk to all the time. And that's triage. So we are literally able to provide, it sounds like you need to talk to somebody. Yeah, for sure. All right, here. You have, in 8 minutes, you can connect directly with one of our coaches, which is a clinical psychologist. It's not just, somebody, a peer support kind of training. And through that kind of movement, we are able to provide this continuum of care. It's integrated with an understanding of how to then move it along a collaborative care model with US practitioners. That's where we are also differentiating ourselves. We have our own practitioners. Right now, it's only in Colorado and California, and part of our fundraising efforts that we're kicking off next week is specifically for this, to really incorporate this into the other states or make it, bigger and more robust. So we are a collaborative care model between AI, arbitrage, and US.
I love it.
And that's really a full collaboration. Yeah.
That's unique. Talk to me about the raise a little bit.
Yeah.
It's happening in a week, so this video will come out after that. So tell me a little bit about what we should know about the raise. Who would be a sort of mission fit partner for you?
So as a little bit of context, we have been bootstrapping. We are
good. I love that.
Yeah,
we love that.
For 7 years, for the first four years and a half, we raised from angel investors.
Cool.
Yeah, and we were backed by Startup Health as well. And one of the things that we discovered is that we really wanted to find who will pay for this. Right? So we started.
It's an important question.
Yeah, it's a very important question. And we started figuring that first is workforce, corporate wellness, employee benefits. And then in the healthcare space, we have different kind of players, community health players, health systems, hospitals, and whatnot that also can and need to pay for these services in the preventive side of things, specifically in the value-based care model right now. So we are we grew our revenues by 3x last year, so that is very important. We raised our first kind of big VC money last year as a part of a bridge. So this year we're kicking off a $2.8 million seed round. And strategically speaking, we are looking for really health systems, payers that can understand the value that we're bringing to this chain in terms of prevention, between $2,000 to $5,000 per year in the first year. It's the saving cost at the minimum, right? At the minimum. We're not talking about those patients that visit the ED like very fast, but we're just talking about a regular patient that doesn't get behavioral treatment right away, and then up to $20,000 per year for actually having access to mental health support right away.
Wow.
So those that are more into reducing the total cost of care from integrating behavioral health, those are the partners that we're looking for.
Let's shift gears for a second, because something that I love about you is that you are a clinical psychologist, and so you're coming at this both from the business side, you're the CEO, but also from the patient care side. So talk to me a little bit about your, moonshot mission for how needs can be met better in the future and what it means for the kinds of patients that you've seen in the past.
So thank you for that. I'm honored to be a co-founder, CEO of a mental health startup, being a psychologist myself. Usually we hear these, let's put nurses in the C-level of a company that works with nurses. Let's do the same with physicians. So in mental health, it should definitely be like that. You cannot have an AI company without a mental health practitioner in the C-level really understanding how that works, right? Yeah. That's unreasonable, maybe. So in my personal experience, I became a psychologist because I lost my father due to mental health, but not having access to it. So my mission is really accessibility, affordability. Like you really have as citizens that we have the privilege to be in this position. We're responsible to really be able to do our best. So that's why I do what I do, right? Yeah. Like really bring on a self-empowerment tool, which is basically through the smartphone. You don't need anything else, just your smartphone. You can chat, you can talk, you can tele whatnot, for a very experienced clinical eye. Yeah. Right. Like the model in the U.S. is quite broken. You cannot go because you feel a little bit bad. You go to the psychiatrist, they prescribe you medication. That's wrong.
Or they tell you there's a 6-month wait.
That's even worse,
to talk to a
because you don't get any kind of thing. So one of the things that I feel like is immediate quality care, immediately, and then you need age to age, human to human, right? Like we need people to listen to people.
Yeah.
That's why.
Can you comment for a second on just the power of the AI chatbot? Because I've read research that shows how powerful it is for people to be listened to, even if it's an automated voice message calling somebody up. There was a study in Australia that was really powerful. So just like someone who's not in the market might think, oh, AI chatbot for mental health doesn't sound very effective.
Yeah. So I have my personal view on that, and as a psychologist, again, myself, most of the people in mental health, one thing is you have to differentiate between those that are doing early identification with AI for some mental health signs to really try to diagnose somebody. Now, in a mental health session, in a therapy, you talk for maybe 40 minutes, for an hour, and 10% of what you say is important. 90% of what you don't say, but your body is saying, your silences are saying, is more important.
Interesting.
So all the chatbots that are working today in fully transcribing the text of just a conversation are doing things wrong from the get-go. That is all wrong.
Okay.
Because you cannot take 10% of everything, which is not as relevant as, imagine I'm telling you right now, I feel very, very sad.
Yeah.
There is something wrong with transcribing that and then labeling it as sad.
Yeah.
So multimodality multimodality means that you have to figure what our face.
Yeah.
So the way you look and the sound and how you sound when you say something.
Your expression, there's also technology with the blood flow and the face.
Yeah, everything. Yeah. Imagine an intervention from a therapist is even the room. That's already an intervention. The hello or non-hello, the hug or just the handshake, that's an intervention.
Yeah.
And sometimes when you work with engineers, they say, oh yeah, but here there is an intervention, but that's very narrow, right? So there is a lot of context to be done, there is a lot of work to be done in order to really try to replicate a therapeutic dynamic between therapy and patient.
Interesting.
And that's something that we really have been working over the past year to really being able to replicate that dynamic just as conversation.
And not just replicate it, but figure out how to do it at scale, since there are so many people in need.
Absolutely.
Yeah. Well, Emilio, love the update of what you're doing. It's exciting that you're having this first raise. Congrats on working and growing the way you have for 7 years, bootstrapping as you have, and just sort of doing the grind, coming back year after year. What are you most looking forward to for the next, say, 12 months in terms of milestones, partnerships?
Yeah, for sure. Our biggest goal is to really be able to impact 200,000 lives.
Okay.
Through a very scalable model. So that's our biggest goal, to really be able to be in the hands of 200,000 lives and provide that immediate quality care. And we're looking for partnership with 3 health systems, a couple of health plans as well, and to figure it out the ways to really scale it through a value-based model.
Okay, I thought I was done, but one more question, which is, there's another side, there's a two-sided marketplace here. There's another side of arbitrage with clinical practitioners, which is actually bringing work, it seems to me, to folks in other countries. What does it mean for the, let's say, Argentinian clinicians that they can tap into a system now? It seems valuable to them.
It's absolutely valuable. This has been happening in the healthcare space forever.
Yeah.
You have companies that work on the dental space, working with dentists from Pakistan.
Yeah.
You have companies working on the fitness space, working with coaches from Mexico.
Yeah.
You have companies working even in the provider space, working with doctors. So this has been happening forever. It doesn't have happened with the mental health industry. So in Argentina, where there is like a full inflation, you probably there is like a lot of things going on. This is very useful for people that really are either struggling or they're really gonna grow their practice. Because having these cultural differentiators as humans, as psychology patient, is also getting us closer to what we are as humans all, right?
I love that. It's really creating a global connection, human to human.
Yeah.
Emilio, thanks for the update. Appreciate it. I wish you the best with your raise, and I think you're going to help a lot of people this next year.
Thank you so much.
All right, thanks a lot.
All right.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.